This is Rural Health Leadership Radio.
Episode 172, a special episode of Rural Health Leadership Radio in recognition of National Rural Health Day.
Giving people that team concept, having strength and understanding their teammates really gives a super solid foundation for success.
Welcome to the Rural Health Leadership Radio with your host, Dr. Bill Oxier. Each week, Dr. Oxier has a conversation with a different rural health leader to discuss what's working and what's not working in rural health, along with other topics of interest to rural health leaders. Rural Health Leadership Radio's goal is to improve health in rural America by providing a simple, no-cost means to share information and connect rural health leaders from around the country. And now, here's Dr. Oxier with today's guest.
Hi, everybody. I am your host, Dr. Bill Oxier, and welcome to this special episode of Rural Health Leadership Radio in recognition of National Rural Health Day. As many of you know, Rural Health Leadership Radio is a 501c3 nonprofit. And like most nonprofits, we're always looking for ways to pay the bills to support our mission. And it's never too late to donate. In fact, we have some special gifts for anyone who donates before the end of the year. Not only is your donation tax deductible, you can also get a free gift, and all at the same time, you'll be supporting the mission of Rural Health Leadership Radio. You can check it out on our website at www.rhlradio.com and just click on the donations page. Now on to today's special episode in recognition of National Rural Health Day. You know, a couple of years ago, in recognition of National Rural Health Day, we had Karen Madden as a guest. It was episode 68. Now, Karen is the inventor of National Rural Health Day, and in addition to that, she's also the director of the Charles D. Cook Office of Rural Health within the New York State Department of Health. Here's an excerpt from our conversation.
National Rural Health Day began as a way to positively recognize and celebrate the individuals and teams who give their very best selves in the name of rural health. And we wanted to focus on all of the very good things about rural communities on National Rural Health Day. And then we did that for about 4 or 5 years and really decided that it really isn't just one day. It's more of it's a movement. And we created the Power of Rural movement because to bring the focus into every day. And from the perspectives of the National Organization of State Offices of Rural Health, which sponsors National Rural Health Day, and all of our members, which are the state offices of rural health in every state, we see the positive results that come from the dedication and tenacity of rural health professionals every day. There's no doubt that without the spirit of collaboration and commitment to innovation, that 60 million people could possibly be left behind. The Power of Rural movement has become an essential platform for rural health stakeholders to share the great work being done to increase and stabilize access to high-quality care, while also working to address some of the disparities that are prevalent in rural communities across the country.
I love the way Karen talked about the spirit of collaboration and commitment to innovation. Rural health is known for its innovation, and for me, in addition to the people that you meet, that's one of the exciting things about working in rural healthcare. Innovation comes in so many different shapes and sizes and forms, and today I'd like to focus on some of the top innovations taking place in rural health leadership. And the exciting part is that I'm part of each of these innovations. So this is a pretty cool story to tell. Innovation number 1, the National Rural Health Association's Rural Hospital CEO certification. At the National Rural Health Association's Critical Access Hospital meeting back in September in Kansas City, Alan Morgan, CEO of the National Rural Health Association, announced the creation of the Rural Hospital CEO Certification Program. And the timing could not have been more perfect. You know, CEO turnover is very high in the healthcare, in the hospital industry, and in particular in rural health. And every time you have a CEO turnover, there's all kinds of study that shows the impact of that. There's a loss of organizational momentum. There's eroding financial performance. Partnerships become less stable. Physician recruitment can come to a standstill. There's community issues, PR issues. Competitors will take advantage. I mean, there's all kinds of impact that have an impact when the CEO leaves, regardless of the reason why. And it also increases costs because you have to recruit for the position. You may have to hire an interim CEO. You may have to pay some bonuses to keep people there, or things could impact quality metrics. There's all kinds of public relations that might be needing to take place, and all those sort of things have an impact on CEO turnover. So a recent study was conducted, and what they found out is that most rural hospital CEOs have only been in their position about half of the time. So half of our rural hospitals have a first-time CEO, and that creates an opportunity to help them achieve excellence through the Rural Hospital CEO Certification Program. Another thing that the study found was that almost 2/3 of the CEOs stayed at their previous hospital for more than 5 years. In fact, 20% of them were there less than 3 years, and 41% remained less than 5 years. That's a startling trend, especially when you think about succession planning, because the majority of rural hospitals do not have a formal documented succession planning process. So that creates problems when the CEO leaves. So CEO turnover is a problem. And then having a pool of qualified CEO candidates to take over the reins when the one CEO leaves is another problem. So the goal of this program, of the NRHA Rural Hospital CEO Certification Program, is to know that if you see a person with that certification, you know that person is qualified to be the CEO of your hospital. Something else interesting that's happened just in the last couple of weeks is that in Georgia, their legislature passed legislation requiring rural hospital CEOs to get special education. And they also included board members in that as well. So there's definitely a trend going in this direction, and we're on the cutting edge by providing this certification program. And the other thing to consider too is, I don't care how successful you may be right now and how successful your hospital may be, there's still a need to develop yourself, because what's constant in rural healthcare? Absolutely nothing. Things are always changing. For a whole lot of reasons, this is an awesome opportunity to provide some great innovation and leadership in rural healthcare. I want to thank Alan Morgan, the CEO of NRHA, for his assistance with this, as well as Brock Slaybach, Larry Bedell, Bill Sexton, Tim Putnam, and Leslie Marsh, all for making this happen. And if you'd like to know more, you can check it out at www.ruralhospitalceo.com. I am truly honored to be a part of this program. Innovation number 2, the innovation achieved through team stakeholder-centered coaching. Now, team stakeholder-centered coaching might not be something that you're familiar with, but I bet greater engagement with your workforce or greater leadership engagement is something you're familiar with, or cultural transformation, quality initiatives, patient satisfaction, lots of different things. And that's the beauty of team stakeholder-centered coaching. It can be catered to whatever program or challenge or incentive initiative that you want to work on, because it's not a prescriptive process. It's something that can be adapted. And that's why team stakeholder-centered coaching is considered as innovation number 2. And to talk about that with us today is Shannon Calhoun. Welcome to Rural Health Leadership Radio, Shannon.
Well, thank you, Bill. I'm happy to be here.
Well, tell us about yourself, Shannon. I'm sure a lot of our listeners know you already, but who is Shannon Calhoun? What's your story?
Well, my story is I am rural. I am a rural person. I was born in the panhandle of Texas, and I was raised on a dryland cotton farm. I actually attended the same school for all 12 years, and the same school that my parents attended.
Oh, wow.
And the cool thing is I was third in my graduating class, and the not cool thing is I wasn't even in the top 20%.
That's pretty good. That's rural. That's a good rural test.
That's a good real test. Well, the other part of my story is that after college, I married a Marine and traveled the world, and I was privileged to see a lot of rural places.
Yes.
After that, we came home, and his hometown, it's a town of 2,000, and I've been here for 25 years. And for those 25 years, I worked in rural healthcare. The first 20, I really was able to engage with CEOs of rural hospitals as I built and managed a network that was owned by up to 13 hospitals at any given time. And then the last 5 years, I had the great privilege of traveling the country and talking with rural leaders, rural hospital leaders, about transformation, the payment and delivery reform that we see with Medicare today and the payment models such as ACOs.
And so it sounds like you didn't have any choice. You had to be focused on rural health because that was just part of your life, it sounds like.
It is who I am. That's right.
Yeah. Okay. So, Shannon, I always like to ask everybody that appears on Rural Health Leadership Radio what their definition of leadership is. So what's yours?
I have studied leadership as of late, just a little bit. And my favorite definition is that leadership is not about management or personal attributes or titles. It's really about having followers. It's about influencing and empowering people to reach a goal.
I love the influencing and empowering, too. Very powerful words that you included in your definition. So thank you for sharing that with us. And thanks for differentiating between management and leadership, too. That's a subtle difference that gets lost sometimes.
Yeah, so, it's important, though.
Absolutely. No doubt about that. So, Shannon, you and I have been talking when we're collaborating together to deliver this team stakeholder-centered coaching concept to rural hospitals. Why did you want to get in on why did you want to collaborate with me on this?
Well, Bill, I'm collaborating with you because you have followers, and truly you do. And you are committed to rural healthcare like I am. My passion is to work in this time of transformation, the chaos that is a result of Medicare's payment and delivery reform. And I'm very interested in helping your followers to learn influence. To influence them to learn influence and to be able for them to empower people to be successful in this transformation time.
Yes, it's very important. There's no doubt about that. I know that you sat in on the panel discussion that we had at the NRHA meeting recently with folks from one of the hospitals that I've been working with. Did you get any key takeaways from that presentation that you wouldn't mind sharing with us here?
The one thing I really loved in that presentation was that there was the one person who was the naysayer in the beginning actually was your biggest advocate at the end.
Yes, the pharmacist.
I feel like the pharmacist. Yes. And so, it was a true testament that your program provides social tools and resources to develop that influence and give the skill to empower rural hospitals to be successful.
Yeah, that was pretty cool. And he is a big advocate.
It was,
and a good friend now, too, as well. So why should a rural health leader be interested in our program that we've put together?
Well, I think that there is an imperative reason that rurals have to engage in change. I talk about the tyranny of small numbers, which means that low volume is really a hard story to tell when people aren't interested in it.
Yes.
And so it is critical that the leaders in each of those rural hospitals have tools and resources, have the capacity to give strength to spread that influence across every employee in their hospital in order to make the change, to be engaged and create high quality and outcomes in their facility.
Yes, it's a matter of survival, you could say. I know we don't like to use that word, but it's very true, isn't it?
It certainly is. I mean, I think that it's, surviving the change is different than surviving or sustainability, but it's really being successful in the change. And so from an individual perspective, each employee really needs to have tools and resources. And it's a new day as far as having to retool people's delivery and the anticipation of what's expected of them because of all the change. So giving people that team concept, having strength and understanding their teammate really gives a super solid foundation for success in this time of survival.
Absolutely. And then one of the key things that you touched on too is, giving them the tools, because they could be very successful as leaders. They could be successful as a hospital, but times are changing. And so you have to change with the times. So no matter how successful you are, we got to keep setting the bar higher because things keep changing. So thank you for sharing that with us. Any other last word that you want to get in today?
Well, no, I guess I would like to say Happy Rural Health Day.
Yeah, very good. Thank you so much for joining us today, Shannon.
Sure. Thanks for having me. Innovation
number 3, the Leading with Impact in a Disruptive World Boot Camp. And to talk about that with us today, we have Kathy Whitmire, CEO of Transformation Health Partners. Now, Kathy, you were a guest here on Rural Health Leadership Radio not that long ago, and I'm sure most of our listeners heard that episode. But tell us who you are and why you're focused on rural health.
Thank you, Bill. Well, for the past 35 years, I've lived in Toccoa, Georgia, a rural town whose economy and way of life depends on our local hospital. And it's really been my passion for the past 20 years to help rural leaders stay educated and up to date on all the new reimbursement models and to help them develop strategies to keep their bottom lines in the black. So that's why my focus is on rural. And since the Affordable Care Act passed back in 2009, you and I have watched our entire industry change over the past 10 years, haven't we?
Yes, we have, and it's still changing.
It changes daily.
Yes.
And the Affordable Care Act laid out a plan to protect patients and make health care more affordable. I mean, we have to, even though we don't agree, we have to change, because over the past 10 years, there have been financial penalties legislated for those that wouldn't change. And those penalties are assessed for things like not achieving meaningful use, for low patient satisfaction scores, low quality ratings, in addition to penalties for readmissions within 30 days of discharge. And when you add those penalties to the 2% sequestration rate, there's a total of about 8% potential reduction in Medicare reimbursement. And then to make bad matters worse, many rural healthcare leaders don't realize they have no payment at all for conditions that are acquired after the patient is admitted to the hospital. Things like patient falls and hospital-acquired pneumonia, catheter-associated infections, surgical site infections, just to name a few. And one more thing. If the hospital employs physicians, they can add another 7% reduction in payments this year under the MIPS program. A new merit-based incentive payment system is going to cap out at 9% of a penalty or an incentive if they implement these changes in the year 2021.
Wow, that's a lot of stuff to keep on top of. So what's the answer?
Well, the answer is really in the question, how does a hospital leader ensure that they change with the times and don't incur these penalties? I mean, it's got to be by implementing new, innovative clinical and financial strategies to ensure their long-term success. And transformation and change must occur at all levels. And that's going to require hospital leaders who aren't afraid to leave the status quo behind and reshape their operations to meet patient needs and consumer expectations. While at the same time, these leaders must learn to navigate the new world of value-based payments. And as we mentioned earlier, the increasing complexity of reimbursement and transformational change just must happen in these hospitals and in the revenue cycle.
So I believe that's a lot of change to take on. So it sounds like rural health leaders need to get comfortable being uncomfortable.
Exactly. Yes. Exactly, Bill. And we have to be assertive in our efforts to bring our rural leaders up to speed and equip the next generation of leaders to ensure that rural Americans have access to the best health care. And I'm truly excited about the opportunity we have with this boot camp to do just this.
Yeah, so I'm excited about it too. Kathy and I are going to be working on this, putting on this boot camp together. And, a boot camp in itself is not innovative, but this is an innovative boot camp. What is unique and innovative about this boot camp, Kathy?
Bill, everyone talks about the importance of leadership in healthcare. But who's talking about how to lead transformation and change in this disruptive, value-driven world we find ourselves in?
Well, you and I are.
Yes. Yes, we're talking about it. And we both know many successful leaders in healthcare, but do they know that they can make a bigger impact in the survival of their hospital with new knowledge and skills like change management? I mean, I think it's time to teach leaders at all levels how to lead change in this disruptive world of retail health care that we're facing, population health, value-based payment models, to keep their hospitals open, not only open, but profitable. And that is what I think makes this boot camp very unique.
Yeah, it sounds like it. That's for sure. And I know that we've put a lot of work into making it unique. So that's great. And I appreciate you providing leadership yourself to put this together.
Well, thank you. I mean, it comes from the concern of over 100 hospital closures in the past few years and huge shortage of CEOs that understand the new healthcare landscape. I mean, there's a tremendous need to educate and prepare today's healthcare leaders to survive in our new world of healthcare reform. But, how does a leader survive in this new economy and gain leadership skills strong enough to change the status quo, we've always done it this way mindset? Yeah,
that's a standard answer so many times. So what are the people that participate in this boot camp going to learn? What are they going to take away?
They are going to take away a valuable field guide of tools that are going to define transformational opportunities in their own hospital, how to lead high-functioning teams. And this field guide will help develop and identify data-driven measures for communicating and fostering a change agenda in their own healthcare setting, whether it's a hospital or a practice. Also, important, I'm excited about the ability to earn a certificate in healthcare transformation and leadership.
Yes.
And ACHE and CEU credits are going to be offered, which I know everyone is looking for, with the documentation they need for their continuing education. And then finally, and what I think is most important, is a follow-up coaching session to review the plan for change and innovation that these attendees create at the boot camp and ensure their team is on board and ready to implement the change agenda that they've developed.
So who should be attending this?
Leaders at all levels. I mean, that includes C-suite leaders, vice presidents, department directors, and managers, and specifically those with a passion for innovation, leadership, and positive change.
Okay, so how does somebody sign up for this?
Well, I hope the leaders listening today will join us in Atlanta at Embassy Suites Buckhead, coming up on January 22nd through 24th for the Leading with Impact in a Disruptive World boot camp. I mean, leadership combined with revenue improvements to the bottom line delivered at this boot camp will ensure an ROI of more than 100 times the investment to attend.
That's a bold statement, Kathy.
It is bold, and I'm telling you that is a very minimum by implementing these new standards.
Okay.
And the information we're going to share at this boot camp is really valued at much more than that, but I'm not going to push my limits. Yes. And seating is limited, so I hope everyone will register today by visiting www.healthcareleadershipbootcamp.com. And every person that attends this boot camp will leave better equipped to lead transformational change with a population health strategy and the skills to survive the disruption of the new value-based payment world.
Excellent. So that's www.healthcareleadershipbootcamp.com. I'll make sure we include that in the notes for the podcast. So, Kathy, thank you for sharing this information about the innovative boot camp that's coming up in January, Leading with Impact in a Disruptive World. Thanks, Kathy.
Thank you, Bill.
Innovation number 4, the Rural Health Cafe Mastermind Group. Have you ever said to yourself, I really don't have anyone I can talk to? No one understands the stress that I'm under, and I can't share that with anyone I work with. If you've ever said that to yourself, you're not alone, because Being a leader in rural healthcare can feel very isolating at times. It can be lonely at the top. That expression wasn't invented for no reason. So if you'd like to join in with a group of professional rural health leaders that are passionate about rural healthcare, that are passionate about leadership, and that are passionate about moving forward, the Rural Health Cafe Mastermind Group just might be the place for you. If you like accountability, if you like collaboration with others and candid feedback and coming up with new ideas, if you like camaraderie with like-minded individuals and all this taking place in a safe environment filled with trust and respect, well, that's the Rural Health Cafe. It can be so rewarding to be a part of this, but don't take my word for it. I'd like for you to listen to what two of our participants had to say. The first will be from Hunter Nostrad, and then we'll hear from Rena Salamanca.
My name is Hunter Nostrad. I'm the CFO and COO at Helen Newberry Joy Hospital. I've been a part of the Rural Health Cafe since its inception. My biggest takeaway has been a great opportunity to network and collaborate with other leaders throughout the country. It's been a great benefit to have open dialogue in a small group setting.
This is Rena Salamanca. I work at George L. Meade Memorial Hospital as a Chief Strategy and Technology Officer. One of the biggest takeaways from participating in the Rural Healthcare Cafe is it's not what you know, but who you know. I've been able to gain a great source of relevant connections that I can call on when I need them. I feel that the Rural Health Cafe provides me with a great source of connections, and it really opens the door to talk to highly influential people that I feel I wouldn't otherwise be able to easily talk to or even find. The Rural Health Cafe, it's not just about who you're networking with directly either. It's those connections that I've made. Those connections that I've made already have a network that I can tap into as well. One of the last things that's kind of more personal related rather than business related, it's that I feel is a big benefit, and is being a part of the Rural Health Cafe has allowed me to already form a ton of friendships, because mostly we're all like-minded individuals that want to grow in our profession. And we also meet and help each other regularly, so naturally strong friendships tend to form as well.
So you heard from Hunter, you heard from Rena. Now, I'm not saying there's any correlation here, but here's an interesting note. When Hunter joined the Rural Health Cafe Mastermind Group, he was both COO and CFO at the Critical Access Hospital that he worked at. Hunter is now the CEO of that hospital. When Rena joined the Rural Health Cafe Mastermind Group, she was the COO at the rural hospital that she works at. Rena's just been named the CEO of that hospital. Now, I'm not saying that joining the Rural Health Cafe Mastermind Group will help get you to the C-suite. You may already be there, but what it will do is align you with individuals who are passionate about healthcare, passionate about leadership, and are passionate about moving forward and lifting the bar higher for themselves as well as others. So you can check it out at www.ruralhealthcafe.com. That's ruralhealthcafe.com, and get the information there. Now, there is a small fee to participate, but the proceeds, 100% of the proceeds go to the Rural Health Leadership Radio, which is, as I said earlier, is a nonprofit. So not only will you get the benefit of becoming a more effective leader and developing some camaraderie and growing as a leader, you will also be supporting the mission of Rural Health Leadership Radio by doing this. So check it out, Rural Health Cafe Mastermind Group. Innovation number 5. Well, you're listening to it. It's the Rural Health Leadership Radio podcast. Now, the Rural Health Leadership Radio podcast has been on the air, so to speak, since the summer of 2016. And I've told this story before, but it all was spearheaded by an idea that I got from talking to the CEO of a critical access hospital in South Florida. And his name was R.D. Williams. When I was talking to R.D. Williams, I asked him what one of the biggest challenges was of being the CEO of a rural hospital where he was located. Now, the hospital he's at is in South Florida. It's in the middle of the Everglades near Lake Okeechobee. The main thing around there are alligators, pythons, and sugarcane fields. It's a very remote spot. And so Artie said that one of the biggest challenges for him was finding out what other rural hospital CEOs are doing, what they're doing that's working, what they're doing that's not working. And he said, it's almost like we keep it a secret from each other of what we are doing and trying and what's working, what's not working. And he said, I wish there was an easy way to get that information and it didn't cost anything. Because he said, I can find that out by going to meetings and conferences and everything, but that takes time and money. And I don't always have time and money. So I wish there was an easier way to share that information. And in my head, I'm thinking, yeah, sure, we would all like to get great value, but we don't want to have to pay for it. How in the heck are you going to do that? So the next day I was out for a run and I was listening to one of my favorite podcasts when all of a sudden a light bulb went off above my head, thinking, I wonder if anybody's doing a podcast on rural health leadership. I made a very quick run home to Google that and I couldn't find anything. And the very next day, Rural Health Leadership Radio was born. And so in July of 2016, we went on the air, and in the month of July, we had 24 downloads. Now, that means 24 people listened. Theoretically, that's what it means. Anyway, they did download it. And so that's not very many, but I was ecstatic because I do not have 24 people in my family. So I knew that someone other than family members had listened. Today, as we speak, we've had over 40,000 downloads of Rural Health Leadership Radio podcasts. And to top it off, I was so honored earlier this year to receive the 2019 National Rural Health Association's President Award due to the work that I've done on Rural Health Leadership Radio podcast. And as I say, the biggest compliment to doing something right is when others copy you. And so I know of at least 3, if not 4 other podcasts that have sprung up since Rural Health Leadership Radio went on the air. So I very much appreciate you all listening, and I hope to continue to deliver quality content that can be of value by sharing best practices in rural health leadership. And you can always check us out at www.rhlradio.com. And don't forget, it's never too late to donate. Special mention, innovation number 6. All right, so I said there was only going to be 5 innovations on leadership that I was going to talk about today, but I can't resist because one of the things that I'm working on that I hope to launch within the next 3 months is the Dynamic Leadership Academy for Rural Health online. So if you're looking for an inexpensive way to get training, professional training on leadership and management, man, have we got the programs for you. So be watching for an announcement about the Dynamic Leadership Academy for Rural Health online. And special mention for innovation number 7, another project that I'm working on that I plan on initiating in the middle of next year is the Rural Hospital Administrative Fellow Program. And that's something I've been working on for a while. And it's again to take young people who are interested in rural health leadership and grooming them and preparing them to take on leadership roles within rural health care and to provide succession planning as well. But of course, that's more to follow. I'd like to thank the folks that appeared on today's program. I'd like to thank Shannon Calhoun. I look forward to collaborating with you, Shannon. Kathy Whitmire, I look forward to our boot camp that we're putting on. Rena and Hunter, thanks for giving your testimonials, for participating in the Rural Health Cafe, and congratulations to both of you on your new gigs as CEO. And I want to issue a big thank you to all of you out there for listening to this special episode in recognition of National Rural Health Day. And I also want to thank the Rural Health Cafe members and the companies who have been guests on the program and given donations, and as well as anybody else who's donated to Rural Health Leadership Radio, especially my own company, the Dynamic Leadership Academy, because without those donations, we wouldn't be able to keep the lights on. We wouldn't be able to pay for the editing and production costs of putting this podcast together, as well as the other programs that we're trying to bring. So if nothing else, please tell your colleagues to listen to Rural Health Leadership Radio. And I thank you so much for being with us here in recognition of National Rural Health Day. Until next week, let's keep working to improve rural America, one conversation at a time.
If you would like to connect with today's guest, please send an email with your contact information to bill@billoxier.com. If you would like to be a guest or suggest someone else as a guest, have a question you would like to ask, or simply want to contact Rural Health Leadership Radio, please use that same email address, bill@billoxier.com. That's BILL@BILLAUXIER.com. You can also visit our website at www.rhlradio.com.
And we'd ask that you please support our sponsor, the Dynamic Leadership Academy for Rural Health. The Dynamic Leadership Academy for Rural Health's mission is to improve rural health, one leader